Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today, I am enthusiastic about my conversation with Dr. Stephen Todd. Dr. Todd is a board-certified oral implantologist and dental anesthesiologist. A lot of syllables in this, doctor. He has a master's in regenerative medicine and now specializes in integrative sleep medicine. Dr. Todd is a clinical cannabinologist and one of the foremost authorities on treating insomnia, snoring, and sleep apnea in the Florida, Alabama, Gulf Coast area. Welcome to the podcast, Dr. Todd.
Thank you. Thank you so much, Dr. Norton. I appreciate that.
Yeah.
Look forward to
Absolutely.
a fun conversation.
Yes, absolutely. I've been looking forward to it. So, a lot of things. You've got a lot of experience, a lot of credentials, a lot of life of kind of uh, focusing on a lot of the challenges in the dental and healthcare world. And so I want to just kind of mine some of that expertise today.
Okay.
And before we get into some of the specific specialties and kind of unique solutions that you have, this is the Truth Behind Dentistry podcast. And so I'd like to begin maybe with a truth or two, wherever you go with this, that you've discovered along the way, kind of relative to some of the pain points in dentistry.
Okay. Well, I think one of them back in the day, a while back when I was starting practicing, was a realization that patients didn't really care for dentistry too much on the receiving end.
Right.
You know, it was always a struggle to get them to relax and all that. So that's why I focused on dental anesthesiology very early in my career. Even in the Army, that's how I got started, was in the Army in dental anesthesiology. And then I just translated that over to the civilian world. And then I was one of the first people in the United States to be involved with implants too, dental implants. When I got out of the Army, that wasn't in the Army, then I translated the anesthesia part and then I got my boards and implants. But at that point, it's even more needed because you're doing more surgery, more invasiveness on people. And so anesthesia became a critical point of me being able to finish those cases and take care of those people appropriately. But even then, back in the day, to control pain, we'll talk about this a little bit more, but to control pain, you just wrote prescriptions for opioids, right? I mean, that's what you did. You took out a tooth, you wrote a hydrocodone. You did this, you did that.
Right.
Acetaminophen, I remember in the day back to ibuprofen, when it was first on the market, if you'll remember, Dr. Norton, it was only in 800 milligram tablets. And then all of a sudden they split it up in 200. So you take more of it.
Right. Yeah.
And those pain pills, to manage patients' pain became pretty routine to use those medicines. And today we know that dentists' hands are tied when it comes to managing anxiety and pain, like I did back in the many years ago. So that's where, in today's world, where cannabinoids will help in the future.
Yeah. Well, I think we've historically taken kind of it's a short-term perspective, just like I think much of dentistry, much of healthcare is crisis intervention, pain management strategies. We're trying to provide relief as a key component, but relief can come in many forms that doesn't necessarily have anything to do with solving the underlying problem, right? We want people to feel better. That's often why they came, because I'm not feeling good. But historically, I don't think we've either known, fully understood, seen the kind of chronic consequences that can develop over time of continuing to treat pain certain ways, and therefore we've gotten into a lot of trouble. So I think, as we were talking about before we actually got on the recording, people will do whatever to get relief, right? If something works to give me relief and I can't find a better solution than that, then I'm going to do that, and I'll do it again and again and again until
Right.
somebody offers me another alternative that might be safer, that's going to accomplish something similar, right? At least something.
Well, this is again back to this DEA. The DEA mandated that every physician, dentist, doctor who holds a DEA permit has to take this course. Okay. And so it's an 8-hour DEA course that I took last summer. And what I took out of the meeting was that the DEA says, well, you can't write opioids without this and that. You can't use any fentanyl is obviously out of the picture. That's a bad deal anymore.
Right.
And then they went into the downside of acetaminophen and the liver problems that it causes to manage the pain. Then they went into the side of the gut problems that ibuprofen causes. And so they left you with nothing in the meeting that you can provide other than a placebo effect for these patients that have issues. And so that's where cannabinoids come in. That wasn't mentioned in this DEA meeting, but for sure, cannabinoid therapy, and I'm not talking about marijuana therapy, I'm talking about everything but marijuana, okay?
Mm-hmm.
But endocannabinoid therapy has come of age now. It's been around since 2018. It's been misconstrued and misinterpreted as being marijuana and being, just sort of a vagueness about it.
Mm-hmm.
And there is a certain population that can't take cannabinoids, right? It doesn't matter that the military can't take it. It's the government that has not mandated that yet.
Right.
But there's about half the population can. And so with that being said, this technology that I work with, I'm on the medical board of advisors of this company called Zyppah, and I'll make that disclaimer. I'm on their medical board of advisors. I buy my own product. They don't give me anything free, but I am in product development with this company.
Right.
And these cannabinoids are game changers when it comes to anxiety reduction, pain reduction. It not on the magnitude of a hydrocodone, okay, but if you take it and you take it regularly, it will decrease anxiety, which will in turn decrease pain threshold. So this technology is around, but dentists, physicians, they don't understand it. They don't understand cannabinoids at all.
Right.
And so they don't use it, and they're missing the boat. They really are. So maybe tell me what more we could talk about with that.
No. So I'd like to maybe get a little bit more background on that, because I mean, if people haven't been taught, if that education has not permeated the educational institutions, then where do they learn? They're gonna have to go.
Good point.
Seminar, conference, maybe where somebody like you has a presentation. So here you are with us today. So let's maybe you can develop that a little bit more about this endocannabinoid system, and how are you then how are you applying this? Or for those that are listening and they're saying, oh, this sounds interesting, there's clearly a need, I get it, I don't know what to do, then how would you inform the listener to say how they can begin to walk into this process?
Well, the first thing is we do at Zyppah, we do provide education. I provide that education. And actually, I think we're doing a presentation on that next spring on endocannabinoids and sleep and that kind of stuff. But the science of the endocannabinoid system is part of what I do in an educational process. I have a presentation to talk about the receptors and how they work and what goes on with this in pain pathways and sleep pathways and things of that nature. And the doctors that are listening and the hygienists that are listening, they need to be able to, they can reach out and I can do a presentation for them online and show them the science. It's not voodoo science anymore. This has been around a while. I mean, it's not going away.
Right.
But the profession overall, the dental profession overall, sort of, I equate them to being sort of like an ostrich sticking their head in the sand.
Right. Yeah.
They're sort of it's there, but my head's in the sand.
Right, right.
You know, and I think it's time to take that head out of the sand and be able to say, all right, what can I do for my patients? So let me give you an example of that. So within the sleep world, as a sleep specialist, I have all kinds of challenges, complex challenges in sleep. Sleep is not giving somebody an oral appliance. That's a dentist's perception of that is, oh, here, let's just make this oral appliance. It could be furthest from the truth. But in sleep, you're dealing a lot with anxiety, a whole lot. And so cannabinoids, CBG, these different cannabinoids, CBN, CBG, CBD, as most people know CBD just by the alphabet.
Right, right, right.
But other than that, they don't know anything about CBG. They don't know anything about CBN. They don't know anything about CBC or THCV, all these different cannabinoids.
Right.
But they do reduce anxiety, and they'll reduce it substantially. And so by reducing this anxiety, you're able to manage much greater part of your life, right?
So the anxiety, diminishing of anxiety is kind of the central piece that influences both the sleep benefits as well as the pain reduction benefits.
Yes.
It begins in that world of anxiety diminishing.
Exactly.
Okay.
But by decreasing anxiety with cannabinoids on a regular basis, then you automatically will sleep better, and you automatically will manage pain better. Because with anxiety drives up the sympathetic nervous system.
Right.
We know that we're always in the fight or flight mode anymore. And the society is. Everybody that comes into somebody's office is in the sympathetic nervous system. Very rarely are they chilled, have a parasympathetic activation. And cannabinoids directly impact the sympathetic nervous system. They directly influence the vagus nerve by slowing it down. And that's important. There is no other way to do that. There's no other. I don't know of a technology. Hydrocodone doesn't do it. Acetaminophen doesn't do it. Ibuprofen doesn't do it. They work on the COX-2 pathways, COX-2 inhibitor pathways.
Right.
So they work differently. And to have this new technology, not new, but it's been around, and to be able to utilize it for your patients, I think is a big game changer. And it's not the only thing in sleep that I use, but it is something that we have grasped hold and used it since the beginning in 2018.
Yeah, that's all very intriguing to me, because it's certainly everybody who would be watching, listening to us today, is going to be dealing with people where pain is the primary concern, and to be able to have a viable solution, whether this is considered to be the sole solution
for
varying levels of pain, or at least a portion of the solution. And maybe you can speak to that a little bit too, but to be able to have something that both addresses pain, but also has many other potential benefits in different directions based upon that anxiety release. I mean, my mind goes to sleep, as we're going to talk about a little bit more here. But also, how many people are even living on anti-anxiety? We're not even talking about, specific physical pain, but anti-anxiety or especially antidepressant medications that could be benefited. I'm wondering by this sort of an approach, that because it wasn't that they weren't really truly needing an antidepressant. Maybe they're depressed, but maybe there's sources and things they're not dealing with. They just need to be able to calm the system so they can maybe even get to and address some of those underlying causes a little bit more. So my mind is just kind of going as to how many applications this really could have.
Oh, yeah, there are tremendous applications. And in the application of sleep, in my specialty, it plays a major role in what I do on a day in, day out basis with these patients. And the other thing that's important is micronutrients. This is not at all paid any attention to, but when people's magnesium levels are off, that's part of sleep. We try to get that right. Another major indicator is vitamin D and B12. These are all major indicators in sleep and sleep-wake cycles. And so I use those as markers to be able to ascertain how well someone's going to sleep. If their magnesium and their D levels, B12, B6 are all off, then they can't sleep. Back to something other people know a little bit about. They know a little bit about D12,
Right.
vitamin D, and
Right.
when you talk about cannabinoids, you're speaking this language that they've never heard.
Right.
But if you talk vitamin D, they go, oh, yeah. I've heard of vitamin D.
Right.
And I've heard of B12,
and there haven't
do
really
that.
been,
and I'm going, well, yeah, but then there's another technology, and then you start talking about cannabinoids, people go, is that marijuana?
Yeah,
or
right.
What is that? So, but we get that. I'm not trying to. I treat a lot of truckers. Truckers have sleeping issues, right?
Yeah.
They can't take CBD,
right,
for their test, for their drive.
Right.
Even though cannabinoids aren't going to get you high, it's still in the same family as THC, so they're just banned from it. So my point is, you have to be able to approach this another way.
Right.
And there's another way to do it, which that you can work around it. I treat with a melatonin product. It's called Ultra Dream in our sleep practice. And what it does, it's a water soluble technology. This is what's really cool. This water soluble technology of melatonin. Well, melatonin is deactivated with sunlight. It isn't active. But what is really cool is that in this technology, they have GABA aminobutyric acid, which is a neurotransmitter.
Right.
And this neurotransmitter helps chill you out. That's the main neurotransmitter that makes the brain wave shift from an intense beta wave to a calm alpha theta wave. So my point is, even with that, with cannabinoids not being able to be used for whatever person, we can use this dream technology, it's called Ultra Dream, to be able to provide somewhat of an anxiety reduction, somewhat of and they'll manage that better too. So there are ways around it, and we'll be developing more ways around it too.
So there's the cannabinoid element. There's specific micronutrients inside or outside of the Ultra Dream product, or is all of that contained within Ultra Dream, or it's Ultra Dream has its contribution, and then you have additional micronutrients that are taken separately? Is that?
Yeah, Ultra Dream is its own entity. It is a water soluble format of melatonin. And a lot of people will say in the sleep world, if we're talking about sleep, that, well, they've tried melatonin or, it didn't work, and it doesn't. If you take melatonin, generally speaking, in a pill or a powder, you do not know the percentage of melatonin you're getting. And the brain only drips 0.3 milligram of melatonin in the pineal gland from the gut per hour. This is a very small drip, and you don't need much. And the beauty of this ultracell technology is that you can drop, it's in drops. Our patients, no matter what, we tell them, here's the dream, take it. They'll call them drops.
Right.
Take the drop. I need some more drops. They'll always say that.
Right.
We'll go, okay, well, here's some more drops. But this technology is amazing in that it allows you to mimic the drip of the pineal gland.
Okay.
Which is important, because too much melatonin is a hormone, not a vitamin. And so, and here, interesting fact about that is, in the United States, melatonin is legal, but in most of the world, it's illegal.
Okay, I didn't
know. Because it's a hormone.
Okay.
But my point is, people do not know, they don't have a clue how much to take. Their people's patients, the doctor's patients don't know. And if you can just, even if talking about pain again, if you just manage the pain with the with Ultra Dream, it will decrease their anxiety. even if they can't take cannabinoids. It will, you can take it before and it will settle you down. And so it's really cool how they've done it.
Are
So
there other elements of kind of in your integrative sleep world? So we've kind of spoken to Ultra Dream briefly, and some of the micronutrients. We've talked about the endocannabinoids piece. Are there other elements that you tend to focus on that you might want to mention?
Sure. I've got a protocol that's the most unique sleep protocol in the world, and it works. I've got a high success rate in my patients. Now, it's not what a sleep dentistry rule plays. They get a dentist to make an oral appliance, and that's about the extent of it, right?
Right.
Maybe a home test or something. What we do is we do a home test. We use WatchPat technology, which is phenomenal technology. And I'll make a specific oral appliance that's very unique, that's off the radar, like we're talking about with the name of this thing. It's totally off the radar. It's called a Zyppah-K. And Zyppah is a phenomenal oral appliance for controlling snoring and also decreasing the apnea hypopnea index on patients. Now, I use that sparingly because many of the patients I see needs APAP therapy right away. I provide APAP therapy. I'm a medical facility, so I have APAPs available. And if their situation is dire, which it can be with sleep apnea, then we immediately start them off with APAP therapy. But what we do is we can integrate in an oral appliance, the Zyppah-K, so that the patient they're not tethered to the APAP forever. So we can actually, through these different procedures, taper someone off an APAP if they choose to. A lot of people say, hey, I'm happy with it, right? You know that. I'm good. Hey, I love it. Hey, I love it when they love it because they're doing good. If they're wearing it. I mean, I have no issues. We give them out. We dispense them. But if they can migrate to an oral appliance, it gives them a whole nother dimension of care that they really don't know is available. And I have seen, Matthew, I've seen all kinds of oral appliances. I've seen many. I mean, I started with dental anesthesiology back in the 80s and 90s. What led me to oral appliances was, as an anesthesiologist, I would put people to sleep, literally, get ready to do all this complex dental work. We didn't know they were sleep apneic. We didn't know they snored. We didn't know anything about them like that. So what happened was, on the exit of the recovery, they would code on me, and they would stop breathing. We'd have heart issues. I never lost anybody, but it sure got the hair to stand up on your neck.
I bet.
And it didn't happen just once. It happened quite a bit. Well, then, a light bulb went on, what is this? Why are we dealing with these issues when it should be so smooth?
Right.
And so I started looking at sleep apnea. I started looking at snoring, insomnia as problems back in the 80s. And I started working with a critical care pulmonologist friend of mine, who's actually still a friend of mine. And we started working together in providing care for these patients. And that's what led me to where I'm at today. And then also going back to school at Miami, Florida, and getting that regenerative medicine specialty and focusing on health and wellness and all that. But you can see where that gap was, right? I mean, no one knew.
Right. Yeah.
And whoever knew, there was very few. So, and the way my pulmonologist friend of mine found out was, he was going overseas on a trip to Africa, and he had a CPAP, and he said, can you make me anything so I can go overseas? Because he couldn't go to Africa without something. So I made him an oral appliance so he could go to Africa.
Yeah.
And this was like oh gosh, 89, 90, I don't know, a long time ago.
Yeah, you've been a pioneer in this journey. The journeys are interesting as to how any of us go from what we first started to discover, things we saw, things that inspired us along the way to go this direction versus that, to make a contribution, right? And something that we got passionate about along the way. So I find it fascinating. I love all of that. And there's so many elements to this, and I feel like we haven't really maybe been able to do any of them individually justice, but maybe that wasn't the scope of what was possible today. But I do believe that you have thrown out several ways of looking both at pain and sleep improvement. And I'm certain that there's people that are watching saying, I want to know more. Like, this was intriguing, but I need to know more. And maybe there's something different that stood out for a variety of different people, that either they see like, I need help, I know people who need help, all the way to, I would like to learn more, and what could I do potentially to develop some greater expertise in any of these areas. So I'm imagining that you could be a resource, a person that people could reach out to or gather information from you, probably for any of those pieces, right?
Right. And some of the pieces I left out are in our protocols. It's not about just an APAP or CPAP and oral appliance. It's also, I'm trained in cognitive behavioral therapy for insomnia. So there's a whole cognitive and behavioral system that is important in treating sleep, because a lot of it is, again, I call it sleep anxiety. A lot of people have that, and they can't sleep, but they don't need an APAP and they don't need a oral appliance. They need intervention, I guess you could say. And with that, there's several procedures that's led me to using breathing re-education, which we haven't touched on, and I use sleep hypnotherapy as part of my protocol. I use a program also called Audio Digital Sleep Talk that I've developed, a series of digital programs to be able to help people slow their racing mind down. So I try to be, from a clinician standpoint, I'm very comprehensive, and to let you know, I focused on oral implantology my first 30 years in anesthesiology, and that was my boards, and that's where I was with all that. But then I switched, after that regenerative medicine master's, I switched to alternative types of therapies. I said, okay, that's traditional,
right?
But alternative therapies, breathing re-education and hypnotherapy and cannabinoids, vitamin therapy. These are all alternative therapies that are valid. They're just not understood in the scope of dentistry.
Right.
So then I started applying this to dentistry, back in sleep rather. So anyway,
part of the truth behind dentistry.
Yes, exactly.
Yeah, it is, because there's all sorts of truths, right? That, I mean, they're true. They're being discovered and developed and implemented. But if people don't know about them, then there's some truths that are lurking behind the surface of dentistry that I mean, could be life changers, game changers.
Yeah, exactly. I went to a sleep meeting, a big major sleep meeting last fall, and they covered all these bases, but all of it was insurance driven, right? And so you don't get the truth with insurance driven concepts, right?
I agree.
You get insurance truth,
right?
And unfortunately, that's the way it is. But still, these alternative therapies need and have a place in dentistry, so that doctors and hygienists can understand how to apply them, and they can charge for them or not charge for them.
Right.
But it all has its place in dentistry for sure.
Yeah. Well, this has been great. You're a wealth of knowledge, and I feel like we've just touched the surface of that. And I would like to keep our conversation going and continue to learn more, because I believe in what you're saying, and I believe these things need to be known. And so I'm doing my little part in helping to advance.
You're doing a great part. Now, your part is master. It's interesting about myself. I'm sort of an island. I've done this for a while now, in sleep also. And so I just sort of, till you guys reached out, I sort of stayed in my little pod.
We're flying you off the island onto the mainland, at least to make cameo appearances. Okay.
Yeah. Well, it's fun. And I want young doctors that have not had any education in this, because they don't, not just young doctors, even older guys, but older guys seem to be, they don't think, you think out of the box. I think out of the box.
Right.
I'm not so sure a lot of older guys still think out of the box.
Yeah. Yeah.
But these young guys that are coming in, and young meaning, hey, I'm almost 70, so anything's young.
Right. Right.
These guys and gals, they need to know.
Yeah. Yeah.
They need to know.
So that's go ahead.
Just so they can help their patients more than they ever thought they could.
Yeah. Yeah, absolutely. So for all those people, for any age, anybody who's listened and said, that sounds good, I want to know more, what's the best way for people to reach out and connect with you?
Well, they can go to look at me. They can go to my website, gulfcoastsleepspecialist.com. I have a website if they want to look at sleep. If they want to use my email or personal email, it's I don't know if you have it or not. It's drstVntdd8@gmail. I have an email they can email me at.
Okay.
They can call me, on my cell at 270-454-8224.
Okay.
So they feel free to reach out. I love talking to the health professionals about it. I just haven't done a lot of it,
Right.
but
and if they want to know more, so I'm thinking there's people who will want more educational learning opportunity. There's some that might want to try the Ultra Dream product. There's some that maybe have any particular challenge or two in mind that they need some direction on. So is off of the website, I'm thinking specifically Ultra Dream, if they wanted to try that product, or a cannabinoid approach, does that, if they go through the website?
No, the website's just based about my sleep practice.
Okay, so
really, and it has a scheduling where they could schedule a Zoom on there with me.
Okay.
On the website, if they want to do a Zoom for just a consultation type thing, I feel free to do that. But these products, what they do is contact us. Call it Jenny, my wife, actually takes care of that, and then she could talk to them about getting the products. Either you can either buy them wholesale or you can buy them retail. Okay. Zalease is a direct sale company, but they don't. You just buy it. I mean, point is, dentists usually shy away from Brasseler. You're a dentist, right? Or somebody, but just one of the largest direct sale companies in the world in dentistry is called Brasseler, who makes, and dentists don't generally connect to direct sale companies too much.
Right.
So my point is that, but we would love to talk to doctors and hygienists about helping their practices and in a way that they didn't know they could.
Okay, that's great. So one more time, phone number?
270-454-8224.
Okay, and email address one more time, since these are important ways to reach you.
Yeah, it's drstVNTDD8@gmail.com.
Okay, good. I'm glad I had.
That's my personal email and cell phone.
Awesome. Well, this has been great, Dr. Todd. Excited to bring you, your message, and some of these products and service approaches to a larger audience, and appreciate your time. This has been great.
Thank you. Thank you for having me. I'm very humbled and appreciative of you just taking the time to ask me. Thank you.
Absolutely. My pleasure. So
You're
for
welcome.
everybody listening, this is the Truth Behind Dentistry podcast. Matthew Norton, and I've been with Dr. Stephen Todd, and we look forward to seeing you next time. Thank you.
Thank you. Bye-bye. Bye, Matthew.